imagination will take you everywhere. The future is always beginning now.
Kian kemari
Universitas Diponegoro, Undip, is one of the oldest public universities in Indonesia, established on January 9, 1957, located in Semarang, Central Java, Indonesia. Since the enactment of the Government Regulation Number 52 of 2015, the status of Undip is legal and it is state university.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Greeting from University Diponegoro, the best university in Indonesia. Universitas Diponegoro, as one of the universities in Indonesia, has declared to be research university with an international reputation in accordance with the vision of become an excellent research university. As an international world-class research university, although UNIF is expected to have a good academic reputation that create globally competitive graduates with excellent competence, conduct continuous research and development for the people with continuous improvement of human resources by international standard capacity development program.
Internationally, Undip has ranked by the QS World University Ranking and Times Higher Education World University Ranking as the top 8 best universities in Indonesia. Undip was ranked in the 2021 QS Asian University Ranking, University Graduate Employability at 2020 QS World Ranking, and in the 2021 QS World University Ranking by subject for Business and Management Studies. Moreover, Undip also ranked by Times Higher Education World University Ranking for Times Higher Education Impact Ranking, and Times Higher Education World University Ranking by subjects for Business and Economic, Life Science, Physical Science, and Engineering and Technology. For environmental sustainability, UI Green Metric also posted Undip at 39th World University Rankings. Undip has a strong commitment to improving the quality of education towards global standards by continuously improving the quality of education for its students, increasing the quantity and quality of research and scientific publications, and contributing to society through community services. Strategic planning and efforts being implemented to internationalize Undip is by opening international class programs in various study programs, allocating scholarship opportunities for applicants from abroad through the Diponegoro Master Scholarship or DIS program, and Diponegoro Exchange Experience Program or DEEP, cooperating with leading universities in the world concerning education collaboration, such as facilitating Undip students to study abroad and vice versa. Faculty of Law has developed with the improvement of the education system, the increase in number and quality of teaching staff, lecturers, as well as the increasing number of facilities and infrastructure supporting the education. Faculty of Economics and Business, the faculty which has an international undergraduate program and Bloomberg laboratory facilities was ranked 501, 550 in QS World University Ranking by Subject 2021. Faculty of Engineering also a home for research center such as Membrane Research Center and Center for Biomechanics, Biomaterial, Biomechatronics, and Biosignal Processing. Faculty of Medicine is one of the best faculties at Universitas Diponegoro. Faculty of Medicine has complete laboratories which support the student practicum. Faculty of Medicine also become the important part of the establishment of Rumah Sakit Nasional Diponegoro, RSND, or Diponegoro National Hospital that belongs to Universitas Diponegoro. Faculty of Animal and Agricultural Science has transformed through sustainable concept and digitalization by the development of digital farming and sustainable livestock. Faculty of Humanities consists of several study programs, include literature, language, history, anthropology, libraries, philosophy, and archives. It has several language centers such as Indonesian, English, and Japanese, the Indonesian History Research Center, and Local Culture Preservation Research Center. Faculty of Social Science and Political Science. It has the International Relations Study Program that is well known amongst prospective students, whereas the Communication Study Program emphasizes collaborations with local and national mass media to channel the student talents by directly practicing it. Faculty of Science and Mathematics is a home for several research centers such as Center for Plasma Research that focus on the plasma application and Center of Marine Ecology, Biomonitoring, and Sustainable Aquaculture that covers a various aspects of marine ecology. Faculty of Public Health aims to create graduates with good competency and skills in the public health. It's supported by academic and research activities that are intensively conducted in the area of occupational health and safety area, health promotion, stunting, and many others. The Faculty of Fisheries and Marine Science has vision to become an excellent faculty in the field of fisheries and marine tropical by 2024. It becomes the center for education, research, and community development for the coastal region. It has Center for Coastal Disaster Mitigation and Rehabilitation Studies and Natural Laboratory for Fisheries Study, Marine Conservation, and Biodiversity, as well as Disaster Mitigation and Coastal Management and Rehabilitation. Faculty of Psychology Universitas Diponegoro also provides international exposure in the form of student exchange and summer course programs. School of Postgraduate Studies was established in order to respond to the global challenge with a multi- and interdisciplinary approach. In Vocational School Universitas Diponegoro, the students were educated with curriculums that is in line with the industrial needs. Apart from that, the vocational school equipped with certified smart green building that use renewable energy as a power source along with water and wastewater treatment system for the water resources. Supporting the vision to become an excellent research university, Undip established the laboratory center with high-tech equipment, several research centers in the field of medicine, food technology, water and wastewater treatment, renewable energy development, health supporting technology, advanced material engineering, culture preservation, sustainable development, and established marine science technopark for research and technology development in the field of marine and fisheries, and the incubation for the startup business, which is open for international and domestic student internship. Undip has various supporting facilities to provide excellent services in education as well as research.
Hello, everyone. Good afternoon. And good morning for our speaker and participants in Netherlands. How are you today, everyone? Could you give me your best smile or give me your best reaction, thumbs up, if if you are doing well today? Okay, seems like we're all doing fine for today, right? Okay, I would like to thank every participant who's already making time for our session today. And before we go any further, please let me introduce myself. My name is Elizabeth Dora, as the Master of Ceremony of today's session. And it looks like we are having our special guest for today. I would like to greet our amazing people here. Good afternoon and welcome to our special guest, to the Honorable Dean of Public Health Faculty Diponegoro University, Associate Professor Dr. Budiono, BSPH MPH. Second, to the Honorable, I'm sorry in advance if there will be any mispronounce of your name, Professor. To the Honorable Professor Dr. Mr. Inde Rechten Bridget Tubes from University of Groningen, Netherlands, as our amazing speaker today. And to the Honorable Mrs. Ulan Kusumastuti, Bachelor of Law, Master of Law, as our moderator today. And welcome to Visiting Professor with the theme, Implications of International Laws for Domestic Public Health. And to begin our agenda for today, let us first say our prayers. Prayer begins. Prayer ends. So, the existence of various global health issues triggers the emergence of several sources of international law. The international health law has quite influenced the formation of law in our country, Indonesia. International health law is also a reference in the preparation of national laws related to current health issues. Accordingly, it is a challenge that international law can be upheld in our society. Therefore, there is a need for an in-depth study regarding the implications of international law on national health law. And today, we will discuss a lot about international health law as well as its implication for the national health law. There will be a question and answer session at the end of today, and it is hoped that every question and also the things that need to be discussed by the participants can be answered by this event. Yep, to begin our event today, we would like first to hear a welcoming speech from our Honorable Dean. Good afternoon, sir. Good afternoon, sir.
Iya, good
Okay.
afternoon. Selamat siang.
Okay. Yeah. Are you ready, sir?
Ya,
Okay. Now I would like to call upon Associate Professor Dr. Budiono, BSPH MPH. The time and screen are yours.
terima kasih. Thank you very much, Mbak. Honorable Speaker, Professor Brigitte Tubes, Professor of Law in Global Context, University Groningen. Thank you very much for joining this seminar. And dear Vice Dean for the Academic and Student Affairs, Associate Professor Dr. Mr. Suli, Vice Dean for Resources, Associate Professor Dr. Aquina Kartini, Head of Undergraduate Program of Fakultas Ustadz Diponegoro, Dr. Sri Windarni, Head of Health Policy and Administration, Faculty of Public Health, Universitas Diponegoro, Dr. Septo Pawelas Arso, my colleagues, the lecturers of Faculty of Public Health Universitas Diponegoro, and students from the undergraduate program, especially from the Health Policy and Administration Department, Faculty of Public Health Universitas Diponegoro, and also students from the Master degree of Environmental Health, Health Promotion, and also Master degree of the Public Health, and then doctorate program of Public Health, Faculty of Public Health Universitas Diponegoro, and of course all of the participants in the virtual seminar. Assalamualaikum warahmatullahi wabarakatuh. Thank you very much for this opportunity. The Department of Health Policy and Administration, Faculty of Public Health Universitas Diponegoro, initiated this event, this seminar, and I'm proud of you, and thank you very much. Let us pray to Allah Subhanahu wa Ta'ala, who has given us dozens of Quran today. I'm delighted today because we can conduct the seminar, detailed implication of international laws for domestic public health, and also it because of the speakers who are very experienced and expert on this topic. Thank you very much for coming. And we know that the international law has a vital role in global health governance and management. For example, in the context of COVID-19 pandemic, how do international legal instruments from WHO, for example, and also the International Health Regulation 2005 regulate all countries. Based on this instrument, the countries should immediately communicate with WHO if a health emergency has the potential to impact across countries. So it is appropriate that governments should pool their resources during a pandemic to overcome the COVID-19 pandemic. Effort have been made from this condition, including limiting the movement of people or mobility of people, and also cooperation between countries to get the vaccine, for example. I think this condition can have an impact on public health in a country. So today we will listen from the expert regarding the law in the global context and the consequences in domestic or local public health. So you have to listen and concentrate to this seminar. I think this seminar will elevate our knowledge and experience in this field. Don't forget to share valuable information with your peers, your colleagues, and finally, enjoy the seminar. Thank you very much for your attention. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you so much, sir, for the speech. And now we're going to the documentation session. After hearing our Dean's speech, we're going to have a little session for documentation. So for all the participants, you can turn your camera on and use the virtual background that already provided by the committee on the chat section below. If you're able to turn on your camera, please turn on your camera all together with us so we can capture the screen and get captured together here. The virtual background has been sent by the committee in the chat section. Okay. Okay, for the committee who's in charge to capture the screen, you can follow my instruction. You can capture the screen in 3, 2, 1. Say cheese. Okay, thank you to everyone that willing to turn on the camera. You can stay turn your camera on during this session, during this seminar. It is totally okay, Professor. With the Yeah, it's okay. So for every participant who wants to keep your camera on, it is okay. Yep, and the commentation session is over, and it means that my session is also over as well. And now we will see each other, but now we will see each other again at the end of the event. And to start the next session, we would like to briefly introduce our moderator first. So our moderator is one of the lecturers in health policy and administrations, and also her expertise is in health law and health policy. Without any further ado, please welcome Mrs. Wulan Kusumastuti, Bachelor of Law, Master of Law as the moderator of today. Good afternoon, ma'am.
Good afternoon, Dora. Thank
Okay.
you.
You may take over the screen, ma'am.
Okay, thank you, Dora. Okay. Assalamualaikum warahmatullahi wabarakatuh. Good morning and good afternoon, everyone. Thank you for being here on the Visiting Professor online seminar. I would like to specifically welcome the respectable Dean of Public Health Faculty, Associate Professor Dr. Budiono, respectable Head of Health Policy and Administration Department, Dr. Septo Paulas Arso, and respectable our main speaker, Professor Brigitte from University of Groningen, Netherlands, and welcome to the Honorable all lecturers of Health Policy and Administration Department and the Honorable all participants of this Visiting Professor online seminar. So welcome, everyone. I'm very pleased to see all of you here. My name is Wulan Kusumastuti, and as part of this Visiting Professor seminar, I will be moderating this session. Today's session is about implications of international laws for domestic public health. So as what Dora previously said, the existence of various health issues that occur globally in the world triggers the emergence of several sources of international law. Those laws are a form of lawmaking agreement that is closely related to international actors. Various international laws in the health sector have been quite influential in the formation of laws in Indonesia. For example, laws regarding human rights in the health sector, pandemics, health tourism, and many others. International law in the health sector can also be used as a reference in drafting national laws related to current health issues such as health technology laws, for example, telemedicine or AI, artificial intelligence, treatment of tuberculosis, and so on. However, in Indonesia, the role of international law is considered as the outermost layer of the legal order under the national laws. Thus, we need a wider knowledge and understanding on how far and how significant the implication of international law for health law at the national level. To understand these issues, we require additional information and insight from competent experts. And this is why our honorable speaker, Professor Brigitte from University of Groningen, Netherlands, is being here with us today. Goedemorgen, Professor.
Goedemorgen.
Goedemorgen. How are you this morning, Professor?
I'm really well, but it's raining a lot here at the moment, and it's very cold. I don't know what is the weather where you are.
We have forever summer, Professor.
You have what? Sorry.
Forever summer.
Forever summer.
Yeah.
Yeah.
Okay.
You never get it exactly the way you want it to, but I have really very much enjoyed watching the beautiful video. That gave such a nice overview of all the buildings.
Oh yeah, all of the
beautiful.
Yeah, all of the.
Yes, it was the Universitas Diponegoro profile video. So,
beautiful. Yeah.
Thank you, Professor. We are very grateful to have you here, and we also would like to congratulate you on the remarkable new position as the Scientific Director in Aletta Jacobs School of Public Health. And
thank you.
How's it going so far on the new task, Professor?
Yeah, I will say a few more words about that during my presentation, because I thought it would also be interesting to talk a little bit about my roles and what I do in Groningen, just by way of exchanging experiences with you. Yeah. So I have also included a little bit on that in my presentation, as you may have noticed in the slides. Yeah.
Yeah, okay, that's awesome. We couldn't wait for it. So hopefully you would be able to continue bringing positive impacts to the organization.
You're most welcome. Thank you very much.
Thank you. Thank you for being here with us today. We're happy to have you here. Today, we are very pleased to welcome Professor Brigitte, a very special guest from Groningen University, Netherlands. Professor Brigitte is a professor of health law in University of Groningen. She is a legal scholar with more than 25 years of experience in the international standards protecting health, with a strong emphasis on the role of human rights in health promotion and disease prevention. To get to know more about our speaker, allow me to share to you and read to you the short summary of Professor Brigitte curriculum vitae. So Professor Brigitte comes from Faculty of Law, University of Groningen, Netherlands, and her current position is as full professor, health law in a global context, Department of Transboundary Legal Studies, Faculty of Law, and as scientific director, Aletta Jacobs School of Public Health. Her latest publications are Towards Legally Mandated Public Health Benchmark, published in International Journal of Health Policy and Management, Expansion of Smoke-Free Policy, Stepping Up FCTC's Gains, published in European Journal of Health Law, and her monograph is about the right to health as a human right in international law, reviewed in various international journals, including by Alicia Yamin in Human Rights Quarterly, also available in Russian language. And her latest honorable position and awards, July 2022, Legal Specialist Award 2022, and Senior Honorary Fellow from the University of Aberdeen School of Law, and then the nomination of Huybrechtsen Prize by Faculty of Law of the University of Groningen. And today she will be sharing with us her expert knowledge on the implications of international laws for domestic public health. Before the next session begins, let me inform about the time schedule. First, the presentation from the speaker, it will take around 60 minutes. And it will be followed by a discussion session with the participation of the attendees. And this session will take around another 60 minutes. And after that, we will have conclusion and closing. Attendees may address the questions by raising virtual hand or through the chat box, but only through the chat box if there are technical issues that you couldn't be able to speak into the session. And don't forget to state your name and institution. With that, I ask that all of us can give our full attention to Professor Brigitte and welcoming her to the screen. Professor Brigitte, the time is yours.
Thank you very much. It's a real pleasure to be here. So I'm going to talk about the international laws for public health. And I suppose you're now going to bring up the slides for me. Is that correct?
Yes.
And
operator, you may share the PPT. Okay.
Yeah, so I am from the University of Groningen, and I don't know if all of you know where Groningen is, but it is in the northeastern part of the Netherlands. Of course, the Netherlands is a very small country, but we are in the north. And in that position at the University of Groningen, I have two roles. And I would like to talk a little bit more about those roles, because we are also sitting here to exchange professional experiences. I am involved with the Groningen Center for Health Law, and I will introduce my colleagues to you in a minute. And since September, I'm indeed the scientific director of the Aletta Jacobs School of Public Health. So I'm teaching at the Faculty of Law and working with the Groningen Center for Health Law, but also now chairing this Aletta Jacobs School of Public Health. Can I see the next slide, please? Okay, and then, well, this is the Aletta Jacobs School of Public Health. Could I also see then move to the next slide? Because what I wanted to show you is our academy building. That is the building that you see at the bottom of the slide. That is where many activities take place. If you defend your PhD, for example, we have a PhD candidate from Indonesia. Her name is Ratna Yuwita, and she is writing an interesting PhD on corruption and human rights, also with an interesting case study of the healthcare system. And she will be defending her thesis on 12 July, and it's a real pleasure to have her in Groningen. But opposite the academy building is the mural that you see here on the slide. And on the mural, you see a painting of a woman. And this woman is Aletta Jacobs. And Aletta Jacobs lived around 1900. And she was the first female student at the University of Groningen. And she studied medicine. And later she became a general practitioner, helping especially deprived women with low socioeconomic status, and also becoming an activist for women's rights and peace later. And so she has become our School of Public Health now carries the name of Aletta Jacobs. Maybe I can see the next slide, because what do we do in the Aletta Jacobs School of Public Health? We are not a faculty in the traditional sense of the word, with a battery of scientific staff. I am assuming that you have scientific staff. We have few scientific staff, but the idea is that we are a network organization, and that we are making ongoing connections between all the researchers from all the faculties and the University Medical Center in Groningen, and also higher education. And we organize all kinds of activities to ensure that scholars from the various faculties start to collaborate and start to engage in multidisciplinary research, with the idea that that public health is very complex and that it needs multidisciplinary research in order to find solutions for the future. And we also try to engage with policymakers. I try to engage also with the Ministry of Health, advising the Ministry of Health on various topics. And we also try to engage within the region with policymakers, from the municipality and so forth. Can I see the next slide, please? And yes, my other role is in the Groningen Center for Health Law, which was established around 2015 with me and a number of then PhD candidates. And on the slide here, you see the researchers, the people that are currently conducting PhD research in the Groningen Center for Health Law. And I will be introducing these colleagues as we go along in my presentation, because I think they have interesting expertise that links to my presentation, and you may want to get in touch with these scholars at some point later if you're interested. And they are also presenters in our summer school that will take place in July. So can I see the next slide, please? If you have asked me to talk about health and law and the international laws for health, and I find it a challenge because I don't know who you are and what you know. And most of you do not have a background in law, so I find it difficult to know what the expectations are. Therefore, and what you are looking for. Therefore, I strongly invite you to send me any questions that you like or things that you want to know, and see if we can find solutions or identify new questions and ideas. And I would like to say at the outset, there is a lot of confusion about the interaction between health and law. If we think generally about legal fields, as you can see on the left and on the slide, there is a lot of legal fields that are relevant for health. There is international law, and in connection to international law or part of international law, as you know, there's human rights law. But we also have to take into account, especially in Europe, I don't know so much about Indonesia, but in Europe, we have to take into account regional law, which is the law of the European Union, but also the law of the Council of Europe, which is very influential in the Netherlands. And then we have domestic law. So international law, including human rights law, regional law, influences domestic law. And I think that's an important message of my lecture, that when we are drafting laws and making laws, we have to take into account these higher laws that influence our domestic law. And I think this is a very good thing, because international standards, human rights standards, have a lot of good things to say about domestic health settings. For example, the right to health influences the way you design your healthcare system. It guarantees equal access to healthcare, for example. And on the right of the slide, you see an enumeration, and I'm fully aware that this is very confusing, but a number of health-related legal fields. We can talk generally about health law. Health law in the sense that it is a multi-dimensional field engaging with domestic, international, regional law, and with a wide range of health-related topics. But we can also say we need to look more narrowly at the interaction between health and human rights. Human rights are very important in the health field. And in health law, human rights are also omnipresent. But we can also talk about global or international health law. And currently there is a movement towards global health law globally. And that is also the main topic of my presentation. Global health law, what is this phenomenon? What are its features? But I say this with hesitation, because global health law also engages with human rights. And then I think it's also important to ask yourself, what is public health law in this broad field of laws and standards in the field of health? Public health law could be a field, and maybe I can see the next slide. Public health law can be an identification of the laws that are relevant for public health, be it international, regional, or domestic. We can talk about the regulation of risk factors for non-communicable diseases, chronic diseases, right? The World Health Organization systematically talks about 4 chronic diseases: cancer, diabetes, respiratory and cardiovascular disease. And in that area, you can regulate the 4 big risk factors, which is tobacco use, unhealthy diets, excessive use of alcohol, and lack of physical exercise. And especially in tobacco, diets, and alcohol, that is an area where law can play a strong role, can play a strong regulatory role. But also there human rights come into play. Laws can be relevant for screening, for vaccination, but also regulating a healthy living environment. I collaborate a lot with a scholar that I really admire. His name is Scott Burris, and he has published a book that's called The New Public Health Law. And I really like this book. I think it's very accessible, very clearly written, and I think also very useful for public health specialists. I am currently working with him and 2 other scholars on a global dimension of this book. It's currently focused quite a bit on the United States, but we are now trying to make a global edition of this book, and which I think is a fantastic undertaking. Can I see the next slide, please? Yes, and if I may be so unmodest, can I let you know about the publications that I make together with other scholars in the field? So there is one book, which is the Research Handbook on Global Health Law, that I edited together with Gianluca Burci. It has a range of chapters about various dimensions of global health law. And then there's the recent book that came out last year on health and human rights, which sets out the interface specifically between health and human rights. It is the second edition, and this is the book that we also mainly use for our course at the University of Groningen, Faculty of Law Master Program, which is called International Health Law. Can I see the next slide, please? Here is another report that Professor Budiono Ketua spoke about the international health regulations. Well, here's a report that we wrote and that you can, I believe, access online, that talks about global health law. So it's easy to access, but it also, for example, talks about the role of the international health regulations, access to medicines, and so on. I'm showing this one. It's connected to other publications, but I believe this one is accessible online, and if not, let me know, then I can always send it to you. By the way, if you have any questions after this presentation, feel free to email me, and I can also always bring you in touch with other scholars. Can I see the next slide, please? So this lecture, I just want to say to you, I believe it's lunchtime where you are, but if it is, feel free to use the chat, ask me a question, interrupt me, feel free to eat your lunch or whatever. And I'm going to ask a few questions and try to address them and engage in a conversation with you. So I'm going to talk about global health law. What is global health law? I'm going to talk about the normative foundation of global health law. And then I touched on human rights, a bit about the sources of global health law, the law of the World Health Organization, the laws of the World Health Organization as an important dimension of global health law, and importantly also the opportunities for new laws. For example, we have a very effective treaty for tobacco control. Do we also want a treaty to regulate food, for example? And in that field, we should also talk about the role of non-binding standards. So the tobacco control treaty is a binding instrument, but do we also want, what do we think, how do we value the standards that have been adopted that are not binding? And then there is a question at the bottom that I cannot see, but I'm sure, yes, I think what it says is, what are the implications for the domestic level that I wanted to highlight, and that I will try to do throughout the lecture, but feel free also to ask questions about that as we go along. Let me check if there is anything in the chat that I need to take into account. No, not right now. So, why do we need a global health law? Why is this an important phenomenon or dimension of international law? I think you agree with me that health is an important need, physical, mental, social need, and that it's important for the protection of human well-being and human dignity. Health is important. We all value health. And what we also see is that globalization, as we see it, has implications for the protection of health worldwide. Products go across borders, people travel across borders, and all of that has consequences for our health. We have seen that, of course, very visibly during the Corona crisis. And what we also see here is that law has an important role to play in protecting many health-related concerns. And the traditional focus, and I think this started already in the 19th century, was an emphasis on infectious disease control. In the 19th century, countries started to collaborate, thinking also selfishly, we need to protect us from the diseases coming from abroad, and we need to start organizing ourselves, and maybe so they started to organize these sanitary conferences, culminating also in some sanitary agreements. But currently what we see in this field of global health law that is emerging is a new and broader focus. There is a focus on lifestyle, importantly, and related to that, non-communicable diseases. There's a focus on environmental degradation, urbanization, and the impact of international trade and commerce that has become very visible. There is also an important discussion about decolonizing global health. And I wanted to address this in one of the slides, and I forgot to include that during the Easter break. At the same time, I realized that maybe I am not the best person to talk about decolonizing global health, and maybe you already have an important discussion about that in your setting. So feel free to make any remarks about that during this or after this presentation. I'm more than ready to learn from you in that perspective. Thank you. Can I go to the next slide? Yes, we've used two terms interchangeably. Do we want to talk about international health law or global health law? I'm using both terms, I must confess. I teach a course in international health law, but our center is focusing more generally on global health law, and I engage in a discussion with other scholars on global health law. Well, if you want to make a distinction, then maybe international health law is this branch of international law that, and the name aligns with the other terms, right, that we have. We have international environmental law, international humanitarian law, but maybe also the focus and the emphasis is more narrowly on preventing the spread of infectious diseases, whereas global health law is a more comprehensive, broader term that sees health as a global concern, transcending national borders, and importantly also accommodates the role of non-state actors. And that might be important because non-state actors, like for example the industry, international organizations also play an important role in health and in global health. They can both influence health positively and negatively, as we are all aware of. Are there any questions so far? If so, please feel free to post them in the chat. I don't feel disrupted if you do so. Feel free to write. It keeps the mind active. Write anything you like. Can I go to the next slide in the meantime? Yes, I think it's also important to ask ourselves the question, what is the normative fundamental basis of global health law? And several scholars have thought about it, and I think we all go back to important scholars like Amartya Sen, Martha Nussbaum, that talk about human capability. And two scholars that have specifically written about health capability are Jennifer Pra-Ruger and Sridhar Venkatapuram. And they have both developed a theory of health justice. And it's about identifying the role of society and government in the field of health. And if I hope I quote them correctly, but it is something like that the realization that society has an obligation to maintain and improve health based on the principle of human flourishing or human capability. I really like it, and I think it also aligns very much with the notion of the right to health as a human right. And Sridhar Venkatapuram has written about the so-called health capability approach. And it's an interesting definition of health, or of what government and society has to do for you to achieve your health. It recognizes everyone's entitlement to a capability to be healthy. So a right to a cluster of entitlements. There's a clear connection with human rights, as I already said. So what it means is that society and government, more specifically, should focus on supporting your capability to conceive, pursue, and revise your life plans. What should government do to ensure that you can pursue your life plans? I think that's an important question. And yeah, it's say you have a disabled person. What does this person need to be able to function in society? It may not be able to walk, but it does need, he or she does need a wheelchair to function. To function in society. Yes, Van Kriswardani, I talked indeed about decolonizing global health, and I'm certainly not an expert on decolonizing global health. I was hoping you already had a discussion about this, maybe in your school, but it's about the recognition of I would say different perspectives of global health, and the recognition that global health should be a phenomenon that is carried by all nations and scholars and individuals around the world. I hope I gave a very general definition right now, so feel free to fill it in more properly and ask further questions. So health capability, and I think health capability is different from the definition of health that we found in the World Health Organization's constitution, because the constitution of the World Health Organization, I don't know if you were aware of that, in 1946, in the preamble spoke about complete physical, mental, and social well-being, and not merely the absence of disease. I think that was a very forward-looking discussion, this discussion about, or definition about health, complete physical, mental, and social well-being, and the recognition of mental and social well-being was very important. But at the same time, it was also a very absolute definition, in the sense that it recognizes something that cannot be guaranteed by governments. And what I like about Venkatapuram's health capability approach is the idea that governments has to do something to help us to function in society. Let me know if you have any further comments or questions. Can I see the next slide, please? So, having spoken about human capability, I think it's important to position human rights as an important foundation of global health law. In the international standards protecting health, we can see human rights as an important rock, a building block for everything we do in the field of global health. And in this human rights field, we recognize that all human rights are interdependent and interrelated. At the same time, it helps for our discussion to make a distinction between economic, social, and cultural rights and civil and political rights, to clarify our understanding of human rights. And economic, social, and cultural rights include the right to an adequate standard of living, the right to health, the right to education, the right to housing. And when it comes to civil and political rights, we can talk about the right to life, privacy, family life, freedom of movement, and so on. And during the Corona crisis, I think there was almost a tension between the right to health and all the other human rights, because government was trying to realize the right to health, but that went to some extent to the detriment of the right to education, but also the right to privacy and family life and freedom of movement. Our access to education, our access to work, our freedom of movement was restricted in order to protect health. So, and that tension was very problematic, and I think we need to keep working and researching how human rights interact in order to have a good understanding of how we can respond in a human rights proof way during a next crisis. Thank you. Yes, so I think it's also important to identify what is the right to health, because if you talk about public health, then the right to health is the key right? That's what it's all about. And we find the right to health in the Constitution of the World Health Organization. as a fundament. So in 1946, the Constitution of the World Health Organization was adopted. And there you find at least a recognition of the right to health and a definition of health, as I already said. And that was an important foundation for the recognition of the right to health in many human rights treaties. And the most recognized human rights treaty containing the right to health is Article 12 of the International Covenant on Economic, Social and Cultural Rights, adopted in 1966. And in the year 2000, an important explanatory document was adopted called General Comment 14. And there you find a really valuable explanation of the right to health that gives a number of important tools for its implementation. We also find, for example, the right to health in Article 24 of the Convention on the Rights of the Child. And there's also General Comment 15 that explains the right to health for children, and Article 12 of CEDAW, the Convention on the Elimination of the Discrimination Against Women. And on the picture on the right, you see, I think, a visualization of the right to health that I think explains a lot. I wrote my PhD thesis on the right to health in the 1990s, but I was criticized by domestic scholars who said, why do you talk about the right to health and not about a right to health care? Because a right to health cannot be realized. It's not something, it's too absolute. But I think the UN recognizes that we need to talk about a right to health, which is a shorthand for right to the highest attainable standard of health, and recognize that it's not only about realizing healthcare, but also about realizing conditions for health. So if we want to have a valuable and meaningful health as a right, then we also need to recognize that underlying conditions, the social determinants of health, are important under this umbrella of this human rights norm. And I don't think I have to explain that to you as public health scholars, because I think you are much more aware of this than many lawyers, if I may say so. So some key concepts under the right to health that you find in General Comment 14. I'm going to summarize this because there's a lot to say about it, but there's the policy context and there's the legal context. And the policy context, I think, is very interesting. What you see here on the left is the so-called AAAQ. So what is important in the health field are the availability, accessibility, acceptability, and quality of all health-related services. And accessibility has 4 overlapping dimensions: non-discrimination, physical accessibility, affordability, and information accessibility. If I may ask you to write in the chat, what is most problematic in your country when it comes to securing access to health-related services? I would really be interested in seeing what is important in your country when it comes to the AAAQ. Is it the availability of services? Is it non-discrimination? Is it physical accessibility or geographic accessibility? Write something, please, so that I can see what lives among you, what you are concerned about. Is it information accessibility? Is it the acceptability? The question of whether healthcare services take into account the cultural preferences and medical ethics? Or is it the quality of care or other health-related services that you are concerned about? Please write something in the chat so that I can see what you are concerned about.
Okay, participants, maybe you would like to
I'm trying to keep you active.
Yes.
But Wulan, if you want to respond to this,
yeah,
feel free. If you have an idea, yes, Chris Wardani would like to respond.
Oh yes, please, Mrs. Chris.
Thank you, Profit Bridget. Yes, I'm lecturer in public health faculty, and I think Indonesia has the problem many problems in policy context, like availability, accessibility, acceptability, and quality. And I think until now, both government and also, of course, many stakeholders like community have to solve the problem all of the policy context. I have no more about the legal context because I study in public health policy. We still have problem all of the.
Yeah. Okay. So you are saying the whole framework is in fact relevant for you, and then I'm saying this is a policy context, but you find it in General Comment 14, which is a legal document which could apply in your country. So you could try to see if this could be an interesting legal instrument for you to work with, to see how this could offer a framework for solutions. There's also the legal context, and that is this notion of progressive realization, which says that in principle, the right to health can be realized over time, progressively. We cannot have perfect healthcare and health system right now, but we need to take some steps. So that is recognized. And then there's the recognition, and that's maybe a bit legal what I'm saying here, but that government has legal obligations to respect, protect, and fulfill the right to health. And respect is a negative obligation, not to harm health, and protect and fulfill are more positive obligations. To protect health and to fulfill health is then to ensure access to health-related services. And I think the notion of minimum core is also interesting because it recognizes that there is a baseline below which no government may fall, and that there's a minimum that should be guaranteed for everyone in society. And it also links to the primary healthcare strategy of the World Health Organization. And for example, it says that there should be access to essential drugs. And that, of course, also links to the essential drugs list of the World Health Organization. So you could try to claim that everyone has an entitlement to the essential drugs that are on the essential drugs list of the World Health Organization. And you could make that a legal claim. If you have more questions about that, feel free to ask. Let's go to the next slide. Yeah, this is a moment where I want to introduce one of my colleagues, because Marlies Hesselman is an experienced lecturer and has now finished her PhD in the field, and she's also a very interesting human rights scholar. In essence, she is a human rights scholar, and she has just finished her PhD thesis on human rights and access to modern energy services that she's going to defend next Monday. And I think she's a very innovative and interesting scholar that talks about topics like disaster law, indoor and outdoor pollution, which I think seems a very interesting topic for you as well, the Sustainable Development Goals, and so forth. So if you think this is an interesting dimension, feel free to get in touch with her. I just wanted you to know that she exists, and we are also here to build connections and alliances and to see what we can offer each other. So can I see the next slide, please? And here's another scholar that I thought you might find interesting, Nathalie Abrokwa-Shuk. I've misspelled the name. I keep doing that because Abrokwa is a name from Ghana. Her husband is from Ghana. And she has finished a very interesting PhD thesis on the right to mental health. It's called The Right to Mental Health, a Human Rights Approach. And she's tried to unpack this mental health as a human right. And if I may summarize her approach, she says the right to mental health includes the right to health, but also a number of other human rights dimensions about the treatment of persons with a mental disability. And the study includes case studies from Ghana and Germany, where she engages in an explanation of the mental health laws in these countries, but in Ghana also some of the traditional practices in the field of mental health, and to weigh them against human rights, and to give an assessment of whether these practices are human rights proof. Her email address is there, so if you're interested, feel free to get in touch with her. Can I see the next slide, please? And the third colleague that I want to introduce to you is David Patterson. And David has a long career in human rights practice behind him and is now writing his PhD. And his question is, does international law provide a framework, an adequate framework to protect and promote the right to health in the context of the climate crisis? So he focuses on climate change and human rights. And what he is also really looking into is this human rights-based approach. And a lot of scholars write and talk about the human rights-based approach, but there is no common approach to assess this or like a common agreement on what is the human rights-based approach. So he has made a very interesting comparison between these various approaches. Yeah, so there's some further questions on the slide that you can look at. Can I see the next slide, please? Then I move to global health law, and the broad scope of global health law. And if you want to ask yourself, so what does global health law contain? Then maybe this is an overview of some core standards and related regimes. And if we look at the core standards, and I think I've already said that, I think the core standards in global health law are the human rights and also the laws of the World Health Organization. And if we look at the laws of the World Health Organization, then important standards are the Framework Convention on Tobacco Control, the International Health Regulations, and a broad set of recommendations, including the Code on the Breast Milk Substitutes. And altogether, they form an important body of global health law. But in global health law, you also see synergies and potential tensions, but not necessarily with other regimes, standards. For example, international humanitarian law, as you may know, this is the law that applies during armed conflicts, also has many health-related dimensions in the sense of protecting combatants and non-combatants, civilians during an armed conflict. And that health protection, I think, is linked to the notion of a right to health. So in that sense, there are synergies between the core standards in global health law and these standards. And the same can be said about international environmental law and also the standards of the International Law Organization and the Food and Agriculture Organization. We can claim that this is also part of global health law. There are also potential tensions, for example, when it comes to the UN drug control treaties that are aimed at protecting undesired use of certain drugs. But at the same time, the inaccessibility of these drugs and painkillers, for example, may be a violation of the right to health. So in that sense, there are potential tensions, but not necessarily. And there's also the international trade standards that also include the protection of public health, but the outcome is not always favorable to public health. Can I see the next slide, please? And that brings me to the notion of regime interaction. We see in global health law and in other dimensions of international law that there is this regime interaction in the sense that various regimes interact in the field. And that is also sometimes called systemic integration. We need to ensure that there is systemic integration in global health law, and that also aligns with an important report of the International Law Commission on the fragmentation of international law. And the message is that in order to ensure the coherence of international law, it's important that we use common standards and that we ensure that there is coherence. And yeah, I agree with that standpoint. So I think it's important to look for coherence in global health law. Can I see the next slide, please? And a scholar who is becoming an expert on that and who has now also finished her PhD thesis in that topic is Megan Beyer. she focuses on global health law with an emphasis on international human rights law, international trade law, and international investment law. And her focus is on this notion of regime interaction and exploring how these various fields interact. And her message, and I think this is renewing, is that international human rights lawyers, international trade lawyers do not always communicate well and are not always experts on each other's fields, and that they operate a lot in isolation, and that they actually should communicate better. And her finding is also that international trade law can very well protect public health. So I think this is, I wouldn't certainly not claim that I'm an expert myself on this field, but on this message, but I want to present it to you as an important dimension of global health law and further research. And if you have more questions about that, feel free to get in touch. Can I see the next slide? Yeah, and then I think if we want to look at the standards adopted by the World Health Organization, then we need to look at the Constitution, the founding instrument of the World Health Organization, in particular Article 19, 21, and 23. What we see there in that treaty is that the World Health Organization can adopt treaties, regulations, and non-binding recommendations. What we see, and you can find it disappointing, at least I find it disappointing, is that the World Health Organization has, in the 70 years or 75 years of its existence, only adopted one treaty, the Framework Convention on Tobacco Control. That treaty was a breakthrough. It's been really important, but I find it disappointing that the World Health Organization has adopted only one treaty. And you can ask yourself, why is that the case? Why has it adopted so few treaties? And an explanation that is given is that working in the World Health Organization was mainly public health specialists and not so many lawyers. But you can also see that it's difficult for states to come to an agreement about these treaties because there's many interests involved. And if I'm correct, Indonesia is also not a party to the Framework Convention on Tobacco Control. Can I see the next slide, please? So if I may summarize the two main instruments adopted by the World Health Organization, then it is the International Health Regulations adopted in 2005, which was, of course, an amendment of prior international health regulations and sanitary regulations, and the Framework Convention on Tobacco Control. Now, the international health regulations are founded in collaboration in this field since 1951, when there was the cholera outbreak, and in Western Europe, and countries were really desperately looking for collaboration to combat these diseases. It's important to realize that these regulations bind all the member states of the World Health Organization. So if you become a member of the World Health Organization, you're bound by these regulations. You can opt out, but I believe no country has so far opted out. But I think that's a very interesting feature of these regulations. And the new regulations of 2005 also take an all hazards approach. So the prior regulations identified a number of diseases that were covered by these regulations, but this one covers all public health emergencies of international concern. And it can be the public health effects of a chemical spill, for example. Now, what I think is, we talk a lot about how countries have to report when they suspect that there is a public health emergency of international concern. Article 6 says you have to report within 24 hours to the World Health Organization. And we've had a lot of debate about whether China reported accurately and on a timely basis to the World Health Organization. Maybe it took a few weeks. And I think it's an important discussion. We also saw that during the Ebola crisis, it took around 3 months to report to the World Health Organization. So maybe we are making progress. But what's equally important under the international health regulations is this idea of being prepared for a next crisis. This idea of the core capacities that you also find, I believe, in Articles 5 and 13, but I may be wrong here, in the international health regulations is the obligations of states to set up a number of core capacities. Yeah, the system is only as strong as its weakest link. So we want all nations around the world to have these core capacities in place so that we can be ready and equipped for a new outbreak, but that we also monitor what is going on in our country on an ongoing basis. Now, the progress of realizing core capacities is not monitored so systematically by the World Health Organization, if I'm correct, but there are external systems, for example, the Joint External Evaluation funded by the United States, which monitors countries' compliance with international health regulations and core capacities. And there you can find a list of a number of countries that have been monitored through this system. But several scholars have criticized World Health Organization international health regulations for there not being a sanction mechanisms. And I must say I have mixed feelings about that, because if you start including a sanction mechanism in international health regulations, then many countries may opt out because they think, well, I don't want to be sanctioned. And so it's a very fragile system that we have, and it's not perfect, but the world is not perfect. Maybe it is the best we have. I'm sure it can also be strengthened and improved, but I think we should also certainly cherish what we have. But feel free to let me know if you have other views on this. Can I go back to the previous slide? Because the Framework Convention on Tobacco Control has 182 state parties, containing open-ended provisions relating to demand and supply. And what's very important also are these guiding principles and more specific principles, for example, on the introduction of smoke-free zones. What we also see in the Framework Convention on Tobacco Control is that there is no sanctions. But for example, in the Netherlands, we have had quite a few domestic court cases where NGOs went to court with on the basis of the Framework Convention on Tobacco Control to claim that the hospitality business should become smoke-free, to claim that there should be no interaction between government and the tobacco industry when making new laws. Can I see the next slide, please? Yeah, I think it's important also to flag the discussion about the pandemic treaty. So what we should realize is that we have now two very complex developments. On the one hand, there's a debate whether there should be a pandemic treaty, a new treaty addressing a range of things. And on the other hand, there is a debate about whether the international health regulation should be revised in light of its shortcomings during the corona crisis. There has been an initiative from the European Union with a fairly narrow focus. There is an intergovernmental negotiating body with the World Health Assembly to talk about this pandemic treaty. And the idea is that this pandemic treaty could address a number of issues that are also mentioned on this slide. But what I find really complex is to see is that you would end up having the international health regulations and the pandemic treaty, which would make it very complex for countries also to navigate. Yeah, you also need to have a discussion about what comes where and what goes in what instrument. Can I see the next slide, please? I'm part of the Global Health Law Committee of the International Health Regulations, and we've issued a statement on this, these two developments and their interaction. And you can access that statement later if you want on this slide. Thank you. Can I see the next slide, please? Yeah, I wanted to highlight one important, I think, provision in the Framework Convention on Tobacco Control that has been very influential in the Netherlands. It prohibits governments to interact with the tobacco industry when making new tobacco laws and policies. In the Netherlands, I already said, NGOs have gone to court on the basis of this provision and Article 8 on smoke-free zones. It's been effective in the sense the case was rejected, but thereafter there was a letter from the Secretary of State of Public Health saying, you know, we should no longer talk to the industry. It's not a good idea when we're making these smoke-free laws or when we are revising our Tobacco Act, we should not talk to the industry. And I think that's been a really good, important insight. I'm sure that parliamentarians are still lobbied by the tobacco industry, and that's very disappointing, but this was a major step. I just wanted to highlight that. And I think if we are moving towards a treaty for food or alcohol, for example, then it should definitely also embrace this kind of provision where you prohibit government to talk to the industry when making new laws and policies. But you may disagree with me, so feel free to comment here. Can I see the next slide, please? So that brings me to the important discussion or some ideas for new standards under the umbrella of the World Health Organization. Of course, it's a very difficult process, and you certainly also need the right person in the right place. When the Framework Convention on Tobacco Control was adopted, the director of the World Health Organization was Gro Harlem Brundtland. I think she was former prime minister from Norway, and she really pushed for the treaty together with a whole group of NGOs. But what I'm personally really interested in is a treaty regulating diets and potentially also a treaty regulating alcohol. But there are some other interesting ideas on the slide, and you can read more about that in our research handbook on global health law, where the final chapter by Gianluca Burci explains these developments in a very interesting way, I would say. Can I see the next slide, please? So a treaty regulating diets could do a number of things. Regulate the interaction with the industry, regulating the points of sale, which I think is important. And this harks back to the idea that at the domestic level you can regulate the 4 Ps, the price, the points of sale, the products, and the I was gonna say marketing. Is there a P for the word marketing? Prohibiting, limiting the marketing of unhealthy products. So all these 4 things seem important to embed also in domestic law. And it would be so nice to have a treaty that informs domestic law and that forces law and policymakers to include this domestically. And in the Netherlands, we have a lot of debate about the introduction of a sugar tax. And we have had very liberal governments for many decades now. And those liberal governments do not want to introduce a sugar tax, do not want to take the tax from sugar from fruits and vegetables, so to lower the price of fruits and vegetables. The marketing of unhealthy products is to some extent regulated, but also in the hands of of self-regulation, which I think is very problematic. So I think we are not taking steps in the Netherlands to realize the 4 Ps in the effective way that we could do it. I don't know. Do you have a sugar tax in Indonesia?
Not that we know of. I don't think we have the sugar tax yet, Professor. But
no, okay, yeah. No, I think there's some a handful of countries around the world have introduced a sugar tax with mixed success. I believe there was some positive outcomes for the introduction of a soda tax in Mexico, where you saw that people with low socioeconomic status, among whom there is a lot of obesity and overweight, there was a reduction of the consumption of these sodas because of the introduction of the sugar tax. And what you also see is that if you introduce a sugar tax, the industry starts modifying its products, reducing the amount of sugar, because then it can sell these other products. So I think it's an important to have a discussion about the regulation of the 4 Ps. And sorry that I don't put them clearly on the slide here, but I'm sure you're aware of that. Let me know if there's any other questions so far. Can I see the next slide, please? Yeah, and that brings me to a scholar in this field who's now second-year PhD researcher. She's half Indonesian, by the way. Her name is Dominique Mollet. And her focus is on child oral health and law, because in the realization that oral health is a very important condition for overall health. She is currently staying also at the European Union Research Center. And her focus is very much on also the regulation of risk factors for non-communicable diseases more generally. So if you have any questions, please feel free to get in touch with her. Can I kindly see the next slide, please? And my last topic is, I've talked about these binding instruments, right? The international health regulations and the Framework Convention on Tobacco Control. But I think we must also ask ourselves, what is the role of non-binding instruments? If we do not manage to adopt a treaty for diets, for alcohol, for example, then maybe soft law is the compromise. So I think overall soft law cannot be overlooked. Many actors interact with international law, and soft law can be the glue to bind these non-state actors to your purpose. And there are many important examples in global health law. For example, the breast milk substitutes code is maybe the most well-known example of a non-binding code that has had a moderate impact on regulating the promotion of breast milk substitutes. The idea is that these products should not be promoted to young mothers because you want to encourage them to breastfeed their babies. But this industry is actually quite aggressive in promoting these products. The general comments under human rights are also not legally binding instruments, but I gave general comment 14 as the example of an instrument that gives a very important explanation of the right to health and can fill important gaps and can play an important role. Can I see the next slide, please? I'll skip this one. Can I see the next slide? So that brings me to the end of this presentation, and to make some final observations is that, I think global health law is an emerging field. Increasingly, scholars around the world are engaging with this field. So I think it's important to check it out, to see what's going on, what is the discussion, what do we think about it, what are the dimensions, and to give your view on it and your perspective, and to identify what is important in your country. I think, and what I personally as a human rights lawyer try to argue for, is that human rights are an important foundation. We see that global health law has important implications for domestic settings. I hope I've given some meaningful examples. We need to talk about how to integrate the various standards in global health law between human rights and trade law, for example. We need to talk about new standards, the adoption of new standards that address important features, developments in public health. We need to talk about expanding the role or the laws of the World Health Organization. And we need to talk about whether we want hard binding standards or whether we think soft law standards also have a meaningful role to play. Can I see the next slide, please? And apologies for this promotion, but we have two summer schools in Groningen. One is comes from my role at the Aletta School of Public Health. The Health Inequality in All Policies Summer School is a school where we look at health inequalities and equality from the perspective of 5 different disciplines, including public health, history or medical humanities, spatial sciences, and law. And now I forget one discipline. And so you will have 5 different days talking about this topic of health inequalities and focusing on a case study. And then the next week, there is a summer school called Human Rights and Global Health Challenges, organized by the Groningen Center for Health Law. And that is more along the lines of this presentation, where you go more deeply into various topics under global health and human rights, including mental health, reproductive health, environmental health, infectious disease control, and so on, really focusing on the law or the role of law and human rights. And there's a possibility to have a package deal to join both weeks and to have a discount. And I quickly checked with our organization, and there are some opportunities for staff visits, for scholarships or funding. And for that opportunity, you can click the link, but the deadline for this year is now passed. But for next year, you could see if you could apply there if you're interested, and maybe also for other opportunities to come to Groningen. Can I see the last slide, please? So I thank you very much for your attention. I hope this was useful. I feel I'm talking a bit into the blind because I cannot see you and look you in the eye, but I hope this was useful, and I thank you for your attention. I hope to see some of you in Groningen one day, and maybe in Semarang, beautiful Semarang. Thank you.
Thank you. Thank you very much, Professor, for the interesting, insightful information and presentation. Now we come to the discussion session. For this first discussion session, I would like to gather 3 questions from the participants, which I think the best is that we could answer to them one by one. And we already have 2 very interesting questions here. But firstly, I would like to show to you the first question is from, let me share to you the PPT for more clear view. So,
yeah, Kanya asks a very important and also very difficult question. Many governments have declared states of emergency, thereby assuming extraordinary powers. This crisis raises several important questions. What are the relevant obligations under public international law? Have they been complied with? What role has international law through its institutions played so far? If I understand your question correctly, this is more a question about human rights. Because I think this raises the question about derogating from human rights. If you declare a state of emergency, then what you are doing is, in essence, you declare that, and let me know if this is not the dimension that you are looking for. You are declaring that you have a state of emergency and that you are setting aside human rights, with the exception of a number of key or core rights, including the right to life. And that has been an extremely difficult discussion during Corona, because what happened was that states declared an emergency without complying with the rules for declaring the emergency under international law. Because if you declare an emergency, formally speaking, you have to notify, if I'm correct, the Secretary General of the United Nations. That did not happen. And what you also saw was that governments were quite drastic in setting aside these human rights and disrespecting human rights where maybe this was not strictly necessary. We must realize that we were dealing with an emergency situation, but I think for a next crisis, we need to ask ourselves, how do you maintain human rights in the best possible way, despite the fact that there is a crisis? And which rights can you set aside? But where do you go too far? I hope this is a meaningful answer to your question. Feel free to speak, and if this is not what you were looking for. In the Netherlands, we did not derogate from human rights, but we went into a different system where we limited, we went into the limitation of very specific rights. So to some extent, we limited the right to privacy. We limited freedom of movement, but we didn't have a formal declaration which set aside all those rights completely. In itself, I found that a satisfactory situation, but we had a lot of debate about that in the Netherlands. And in the Netherlands, people are very focused on their autonomy. This is a very big issue in our country. And I felt sometimes even that went too far, that people were not aware of the importance of solidarity in society, and that sometimes you have to take a step for the greater good. Like there was all this were big movements in the Netherlands of people who did not want to vaccinate themselves, and they claimed their physical integrity. So I think the discussion in my country has been very different from the discussion in your country. Sorry if this is not a coherent answer.
Okay. Miss Kanya, maybe you have any comments or feedback? Well, in Indonesia itself, Professor, we already ratified convention related to the health sectors, and from these ratifications implied to the national laws, and if it's regarding the pandemics and the immunization or the vaccination of the COVID, we have a wide range of population that has already been covered with the vaccination. Maybe that's what I can add to Kanya's questions, and move along to the second question. It's from Mrs. Chris. Very
yeah, that's I knew that this was going to be on the table. I think this is this is of concern, and I think I mean this is your topic, isn't it? Because you, as public health experts, you see the extremely detrimental effect that smoking has on the population, and the need to regulate tobacco, and hence a need to ratify, to become a party to the Framework Convention on Tobacco Control, and or to regulate tobacco more strictly in your country. You want to protect children from starting to smoke, from you want to offer children a healthy start in their life. And we also know that 90% is some information I got, of adult smokers started before the age of 19. So therefore, we especially want to protect children, future generations, from starting to smoke. And we also know that the tobacco industry is very keen on getting these children and adolescents on board, because they are the so-called replacement smokers. We also know that the tobacco industry is faced with stricter and stricter regulation in countries like Australia. Australia is doing really well in this field, US, but also Europe, and is moving its markets to other countries. But maybe you have your own markets and your own production, so maybe that's not so much an issue with you. But I'm concerned about children, and that's why I've also used the Convention on the Rights of the Child Treaty, the Children's Rights Treaty, to argue that the non-regulation of tobacco is a violation of the right to health of children, and is a violation of the best interest of the child of children, the best interest of the child norm under that treaty. So, and I was also going to say, I'm worried that in Asia, I don't know how common smoking is among women, but this may change overnight if suddenly the tobacco industry manages to frame smoking in such a way that it is cool for women to smoke, or that it is a sign of emancipation, as they did in our societies. Then suddenly women may start to smoke, and you may have an additional public health disaster, because you will have lots of women smoking. So I think it's a really important problem. I have a book here. It's called The Golden Holocaust. I don't think it's a very appropriate comparison, but the book is by an American scholar called Proctor. It was published in 2011. And the message is 100 million deaths in the 20th century due to smoking. And that is bigger than the people died during the Second World War because of the Holocaust. I don't think that the comparison is very tasty, because the Holocaust was absolutely awful, but I think still it's important to put on the table that it is such a big disaster, and that we need laws, international and domestic laws, to regulate tobacco.
Yes.
Yeah?
Yes, Mrs. Grace.
Professor, yes, thank you.
My
Bulan.
comment.
Prof. Richie, is it enough to make more a lot of advocacy and of course a lot of efforts from many organizations? Okay, I'm sorry. Yes, Prof. Richie, I'm sorry. Is it enough to make more advocacy or make more efforts from main organization, both government, like we are in public university or public faculty, and non-government organization to our government to make the certificate about FCTC. We are concerned about that. That's a big problem.
Yes.
Yes,
Yes.
it's a
So
big problem.
important question.
Yes.
We have had a very strong NGO lobby in the Netherlands by doctors. And there is one doctor, and I'm going to type her name because you may want to simply Google her and see what she does. It's a Dutch pulmonologist. Her name is Wanda de Kanter, and I think her voice has been extremely important in the Netherlands. She established an NGO in the Netherlands, and she is continuously fighting for stricter tobacco law in the Netherlands. So you may also want to engage with medical specialists. They can have an important voice. There was now also a small video by a number of doctors on TikTok where they strongly advised young people not to vape, because the vaping is now also coming up as a new challenge in our society. As you know, I mean, I don't know how big it is in Indonesia, but what I know in Australia, they have managed, I think, fantastically to move smoking out of the world of children, but the vaping is now coming up as a new phenomenon.
Yes. Thank you, Prof. Richie.
I see many interesting questions, by the way.
Yes.
Really nice questions. Where should I start, Milan?
Well, first of all, can I make some comments on the Mrs. Grace question? So, as far as I know, one of the reasons why Indonesia hasn't ratified the FCTC is because in Indonesia itself, we already have a national regulation on the tobacco control. And so, but I think if, as far as it's still needed for creating the global health resilience system, then the international influence can do more stimulus and supports to Indonesia to ratify the convention. So that's
maybe yes. Maybe.
Yeah, and also to regulate it in other countries, right? You want it. It crosses borders. The product, so you want all countries around the world to regulate tobacco and smoking and exposure to secondhand smoke.
I'm sorry, don't forget some of non-government organization spoke in front of our parliament, but I don't know.
Well, I would say keep fighting for it and stressing
I think keep fighting about that.
Absolutely, and stressing also the interest of children, I think, is very important.
Yes.
I'm assuming Indonesia is also a party to the UN Convention on the Rights of the Child.
Yes.
And we have in various publications stressed the importance of the protection of children in this context.
Yes.
Thank you. So important discussion.
Yes,
Thank you for
I think
engaging.
so. I think so. We keep fighting until now.
Thank you. Unfortunately, we have to move along to another questions, Professor. Maybe it's your decision to choose the questions. There are lots of questions addressed to you.
Yeah, let's have a look. Let's start at the bottom. foreign priorities, national security rules, concerns. What role does international law play in helping develop global health policy aimed at improving public health in low and middle income countries? Yeah, that's of course a super important discussion. Also about the for example, during Corona, if that's what you also hinting at, it was about the distribution of vaccines in an equitable manner across the globe, which did not happen in a satisfactory manner, and which, yeah, you could see as being a tension with the right to health. So I would say international law should also ideally foster these kind of concerns, but it only does so if you also help to write about this in a way that you think is favorable to what you need in Indonesia. So we need you all on board of this development of this global health law to ensure that it also protects your interests. And would you like to respond, Leah?
I think I didn't even find the question from Leah.
Okay, that's at the bottom. I will move to the next question.
Yes. Okay.
Yeah, what are the challenges in implementing the implications of international law on domestic public health? And what are the toughest challenges in your opinion, as well as solutions? In terms of implementation, what we have in the Netherlands is that we have and this is a bit legal, but we have a system of monism. So if we become a party to a treaty, it is a national law. So we don't need a further law to ensure that it is a law. But in many countries like United Kingdom, the law, the treaty on tobacco needs to become a national law before it can be implemented. So that is one technical legal challenge. But I would say in terms of public health challenges, I feel uncomfortable talking about this in front of an audience of specialists in public health, but I would say, and you probably agree with me, that it is the global rise in non-communicable chronic diseases, the importance to regulate the risk factors for these diseases, but it is also the challenges posed to us by climate change and environmental pollution. It's health inequalities that we see both within and between countries. And so forth. Is there anything else that you would like to, that you feel I haven't mentioned now?
Aletta, maybe you would like to comment? I think it's clear enough for Faiza.
And then there is Anicia, who talks about legal products. And how can it ensure that it takes into account different characteristics and culture of the population? I think I need a bit of explanation here what's going on in your country. And maybe that can help discuss it and address the problem, especially for residents in the interior of Indonesia who do not even yet have access to various informational technologies that develop outside and tend to avoid globalization. Is that maybe an issue of triple AQ, distribution of health services, the inaccessibility of care in maybe more remote areas where you feel that basic health services are not sufficiently available yet in certain parts of the country?
Yes, Professor, if I can help answering, or maybe Anisha, you would like to say some comments to Professor Brigit's question. So in Indonesia, we have, well, it's absolutely right what you said, Professor, the challenges in Indonesia, other than we have our own local wisdom, so that we cannot like fully adopt the international regulation into our country without thinking about without I'm sorry, what is the word? Without considering the local wisdom in our country and the challenges also, because we are a very big state with thousands of islands. And the problem is the distribution of the health services, of course, in Indonesia. So yeah, it's correct, Professor Pijit, what you said about the obstacles here.
If I look at you as a group, I think you have already made a move by organizing this event, in the sense that you put public health experts and legal people together and to discuss these problems. I think you need to work in an interdisciplinary or multidisciplinary fashion to find solutions for this. So I think it's great that you are organizing this event about law in this public health setting. That is already a step to start to come to a better understanding of how to address these problems. So I think Wulan and your colleagues, it's a great initiative that you engage in this interaction, and that you see that lawyers need public health scholars, and public health scholars need to engage with the lawyers to come to common solutions. And also the other disciplines, of course, like health economics and so forth.
Yes, agree, Professor. We need to have a system thinking to solve the health sector problems in our country. And maybe we can move along to the next question, Professor. Which one would interest you the most?
Well, they're all good and interesting questions, sometimes also difficult. There is a question from Risti about the Willow project. It's causing controversy in the community. It's not directly linked to international law. It will have an impact on human rights and the environment. And if it is related to domestic public health, it is actually not directly related, but can be linked to the environmental impacts it causes. How will the Willow project in Alaska affect each state's domestic public health and environmental regulation? Can you explain to me what the Willow project is? Sorry for my ignorance.
Okay, Risti, can you speak up and explain to us about the Willow project?
Yes, sir.
Yes, yes, Risti.
Yes, Miss. Permisi Bu, sebenarnya
Yes.
Saya tidak bisa bahasa Inggris, jadi.
Oh, it's okay.
Is it okay, Prof? I'm explaining.
Yes.
Indonesian.
She would like to explain that in Indonesian language, and maybe after that I could translate to you.
Yeah.
Oke. Setahu saya tentang Willow Project ini, setelah saya baca-baca, ini merupakan project tentang pengeboran di Alaska begitu, Profesor. Jadi ini juga ada sebenarnya ini perusahaan swasta yang mengebor minyak untuk mendapatkan keuntungan yang lebih seperti itu. Jadi yang menariknya di sini adalah saat Presiden Amerika Joe Biden menandatangani tentang persetujuan untuk melakukan Willow Project, di mana itu akan pasti dampaknya ke seluruh dunia, begitu Bu.
Okay, so Willow Project.
Joe Biden is involved.
Joe Biden, yes, because this is a project from United States. It's about the oil drilling in the Alaska, and Risti is concerned about the pollution that will affect it all over the world. And the Joe Biden here, the role in this Willow project, that is he had already approved this Willow project to be conducted. So it's a pollution issue.
Yeah, so it's an issue of international environmental law, I would say. And I'm not an expert on international environmental law, but I would say that there are certain laws that should ideally be applied. But I would also suggest it's an issue of human rights. It's an issue of the right to health, the right to a clean and safe environment. And in fact, in the Netherlands, we've had a court case against Shell, the Dutch oil company, where it was claimed by an NGO that Shell, the oil company, does not respect human rights by conducting its activities. And it's maybe unbelievable, but the court recognized this violation and so established that that Shell had violated these human rights. So I would say take action, keep fighting, make sure there's NGOs who come up for these things, use international standards, use human rights. That may be a very painful and long route, but I think it's worth it. And I agree with you that this is very problematic, and we should continuously look for other energy sources rather than exploiting and abusing our land and also land elsewhere.
Okay, thank you, Professor, for the answer. So, Christy, that was the answer from the perspective of human rights. I hope it's enough answer. And
thank you,
Professor.
Thank you, Professor, for the explanation and suggestion.
Thank you. You're welcome.
Yes.
Health problems in every country are different. Can every international law be adopted by every country? If so, what are the steps to adopt so that the law can be implemented in a country? Yeah, okay. Yeah, it was a question from, oh, sorry. Yeah, here, from Ferdina. Can every international law be adopted by every country? Well, and what are the steps to adopt so that the law can be implemented in a country and is relevant to the problems in that country? I think if you talk about human rights, then it relates specifically to the discussion about the universality of human rights, right? Do we talk about, does human rights law reflect values that apply or that are recognized by globally? And that is a big discussion in itself, where there's different opinions. I myself tend to be a universalist, believing that human rights are indeed standards that are universal and have global application. But there is also a scholar in the Netherlands who has identified so-called receptor approach vis-a-vis China, saying that the treaties we should also look at how the treaties are received and that there is a certain cultural setting. That is an interesting idea, but I think it can also have dangerous sides where you start disrespecting serious human rights violations. But for law, international laws more generally, maybe you are asking the question, is the Framework Convention on Tobacco Control, for example, an instrument that is suitable for application everywhere? I would think so. It's very generally worded and the provisions aren't very specific. So it gives a lot of room for flexible interpretation. At the same time, I think it's very important for countries to adopt and implement this treaty because it has such important consequences for the health of the population. I find your question intriguing and interesting, but I'm not sure if I've given an appropriate answer. Maria, why public health professionals need an international and local focus when we look at policies? I think you need both a local and an international focus, and where necessary, regional focus. You need to act locally, but also think globally. And there is an important interaction between the local and the international and global. Because if you conduct research in Indonesia with important findings about infectious disease control, for example, then that research may also serve other parts of the world. So there is an ongoing interaction between countries and between the international and the domestic and the local. And we need to keep engaging in these interactions. And also the international, as I've tried to show in this presentation, has identified important standards that can apply domestically and locally.
All right, Professor, unfortunately, we have reached the time limit for the discussion session. Yeah, we have lots of interesting questions. So thank you very much, Professor Bridget, and all the active participants for the interesting discussion session. We finally come to the end of the session. Before I close the session, I would like to take some conclusion for our this event. So
wow, difficult challenge.
Difficult challenge, yes.
Yeah.
So global health law, as part of international law, has an important role to play in protecting health-related concerns worldwide, and it's an emerging field due to the implications of globalization to the health protection. Moreover, not only to the traditional focus of handling infectious disease, but also new and broader focus such as the issues of lifestyle, NCDs, environmental degradation, urbanization, and also impact of international trade and commerce. The normative foundation of global health law is human capability that gives entitlement to the importance of the human rights, which is the right to health. There are new areas that can be proposed to be regulated into WHO standards, such as the issue of communicable and non-communicable disease, and global governance frameworks, including pharmaceutical markets. Soft law in global health law plays an important role in filling regulatory gaps, as well as having the influence to address the interaction of international actors in engaging new forms of health sector collaboration. There are important implications of global health law to the legal development in Indonesia, such as chronic disease control, infectious disease control, and future pandemic regulation. With more systemic integration, global health law can be used as the guideline for Indonesia to contribute to a global health resilience system. Professor Bridget, maybe you would like to say some additional conclusion or a few comments for us to wrap up the session?
No, only that thank you for this excellent summary, and I want to congratulate you on this excellent event and interaction between law and public health. I want to thank you for your attendance. It's always difficult to concentrate when somebody is speaking on a screen, so thank you for your attention. Thank you for asking interesting questions. It was lovely to meet you, and I wish you lots of luck with your important institution, your important work in public health, in health law, in Semarang. I hope maybe we meet again one day, maybe live. That would be much better. I hope to meet some of you in Groningen, and I wish you all the best. Thank you so much, and bye-bye.
Thank you very much, Professor. We highly appreciate for your contribution and for the informative and remarkable presentation, discussion, and also the opportunity to go to Groningen. Okay, ladies and gentlemen, I sincerely apologize for any mistake in moderating the seminar. And finally, let me end the session with the quote from Henry Ford saying, "Anyone who stops learning is old, whether at 20 or 80. Anyone who keeps learning stays young." Thank you, everyone. Wassalamualaikum warahmatullahi wabarakatuh. The session is closed. Getting back to the MC, Dora.
Okay, thank you so much, ma'am, for being the moderator of the session. And thank you so much for a very insightful session with our amazing speaker, Professor Bridget, and our moderator today, Mulan. And thank you for all the participants who already participated with various and interesting questions in our discussion earlier. And now, moving on, we're going to have a little certificate submission to our speaker and moderator. To the first one, we would like to give the certificate to our speakers. To our speaker, Professor Bridget, are you still here with us?
She's not here already.
I think she thinks that the event is already end.
Oh, okay. Okay, I think I can follow this up to Professor Bridget with by email.
Okay.
Laura, you can continue.
Okay, so this is the second certificate for our moderator today to Memolan. And after we give the certificate, we would like to have a documentation with the certificate first. To the committee who is in charge, you can capture the screen. In 3, 2, 1. Okay, thank you so much for the committee of the certificate, and thank you so much for Memolan of being our moderator today. And now, finally, we've arrived at the very last session of our event today. Thank you very much for attending this event and participating from the beginning until now with us. And I would like to remind all the participants to fill in the presence link and the evaluation link. And at the very last, I would like to sincerely apologize if there are any unintentional mistakes in words or behaviors as the master of ceremony today. The session is closed. Good afternoon, everyone. See you at another chance. Have a great day.
Thank you, Dora.
Thank you, ma'am.
Hello, my name is Dinda.
And my name is Zelda.
We are here to tell you 10 things you should know about Undip.
What are they?
First, Undip or Universitas Diponegoro is located in Semarang, Central Java, Indonesia. You can reach Undip 1 hour flight from the capital city, 1.5 hours flight from Bali, or 2 hours by car from Borobudur.
Besides that, Semarang also has many tourist attractions, such as Kota Lama Heritage, Gedung Songo Temple, and many more.
Second, the name of Universitas Diponegoro was given by the first president of Indonesia, Insinyur Soekarno. He gave this name as a tribute to the university's performance in development of higher education in Central Java. Amazing, right?
Third, Undip is a home for thousands of students and faculty staff from all over Indonesia and overseas. 40 rare plant species.
Undip is also a home for deers and a big cow statue. Fourth, Undip also has 11 faculties, 2 schools, and 169 study programs, which consists of 53 bachelor degree, 39 masters, 16 doctorates, 24 specialists, and 37 diploma.
The fifth thing really makes us proud. Undip has a long list of reputation nationally and internationally. Undip is listed in 2 major international system rankings. such as QS and THE for World, Asia, and ranking by subject.
Undip is also ranked second in Indonesia based on Green Metric ranking system. The ranking that measures the performance of green and sustainable campus. Besides that, Undip is also included in 100 to 200 in the world, based on the THE Impact Ranking. Which is analyzed based on the performance of university against the United Nations of Sustainable Development Goals.
The sixth thing is, you will get so many benefits if you study here. What are they?
You will get access to this university dormitory, Rusunawa Home, for more than 1,000 students, green building campuses, library, high-tech laboratory, or UPT dan Bloomberg Studio, or even living laboratory, FPD, sport facilities, hospital, and many other facilities in walking distance. Everything is in here. Undip also has a twin building, not this building Petronas, but more like this building, ICT Center. In here, we can also find Golden Gate Bridge, but in the super tiny form and installed in the arch style. It's called Sikata and Sicebom. And we also have the miniature of Lake Kariba, which called Diponegoro Reservoir. Seventh, Undip has a commercial professional radio channel under the name Pro Alma. You can also listen to Pro Alma through streaming Pro Alma YouTube channel.
8. Undip has 6 campus locations in 6 different cities. They are located in Semarang, Rembang, Pekalongan, Demak, Batang, and Jepara. Wow!
9th, Undip use some of renewable energy sources, including solar panels, chillers, and clean biomass or biogas, as well as hydropower.
The last thing you should know is that Undip also manage 1 hectare campus forest inside the main campus. And 100 hectare campus forest outside for research and management in the forestry. Biological resources and environment sectors. So, what are you waiting for? Join us now here at Universitas Diponegoro, conducting research for humanity.